to this session, being held in what I often fear is the worst room in the Friday Center. It doesn't lend itself to sort of friendly interaction, so I'm going to try to make you be friendly with each other as best I can from where you are in your, chairs and seats nailed to the floor. We're going to be talking today about bridging the gap, translating global hygiene research into policy for public health. I'm very happy to be moderating this. And I'm very happy because I feel it follows on nicely from the plenary session that many of you might have been in earlier, and some of our panelists are here, in which we talked about the challenge of turning guidance into policy and practice. And I think the issue of having good research to underlie both how guidance is written, and I think Bruce mentioned that, how dependent WHO, for instance, is in having good research and good evidence, but also good evidence to back up the way we turn that into policy and practice. So we're going to be talking about that, particularly about hygiene, which has been within the water, sanitation, and hygiene community a bit of a neglected area. And of course, particularly good to be talking about it today, Global Hand Washing Day. So happy Global Hand Washing Day, everybody. So I'm going to kick off because I think many of you may know that in December of 2023, Reckitt's Global Hygiene Institute sponsored a global hygiene symposium. Some of you who are in the room here were at that. Many of you may be curious to hear what happened at it. The full report is available, and we've got several copies of that. Sarah's got copies of that, and there's also a QR code that you can click on to download the whole report. But I thought we would start off just by having a couple of the people who helped organize it talk a bit about what their takeaways were. So it was held in Singapore. It was co-hosted by Reckitt Global Hygiene Institute and Chatham House. There were about 70 participants there were researchers, practitioners, policy influencers, and it was designed to explore the potential benefits of closer collaboration and cross-disciplinary collaboration and integrated approaches. So I've got here beside me Robert Redwolf from the London School of Hygiene and Tropical Medicine, who works with RGHI, and Henry Northover, who's a policy advisor to RGHI. And I just want to ask, you are both deeply involved in planning the symposium and participating in it, and what were your main takeaways? And what do you think we learned about how to make undertaking hygiene research a higher priority and to make research more impactful? And which I think you're going to go first, right?
I'll go first. So it was held in Singapore, which allowed us to hear from Singaporean government officials on how they managed to deliver, I guess, is what is commonly known as the cleanest city in the world. And it was quite, for me, acronym. And I find it really interesting that in the Singaporean context, not just in Singapore, but in other East Asian states, actually hygiene becomes the organizing principle of the nation-building project. Hygiene, but it's also hygiene in its widest sense. So I guess one of the orthodoxies or traditional approaches we have here at UNC and another sector fora is that you have hygiene, menstrual hygiene management, hand washing, and so on. So some of these traditional, more narrow sectoral approaches, subsectoral approaches. Whereas in East Asia, there is this much broader conception. So it's hygiene that stretches from and indeed the country, a sort of a wider environmental cleanliness. And we had an intervention from the Director General of the Ministry of Environment explaining some of the political drivers behind that. So the leadership in Singapore was really central in this wider project. And it's a project that saw the obligations of citizenship tied to obligations to oneself, one's home, and one's community, that was built around notions of cleanliness and, the whole idea was essentially building the conception of a modern nation, which was essentially one that was clean and healthy. And that was kind of interesting because traditionally we, I guess particularly here at UNC, see hygiene within the context of human health. And it was interesting to hear some of the other participants from governments in, I think, Tanzania and others who say, well, actually, for key decision makers, hygiene is much more attractive if it's articulated within the context of trying to achieve a notional modernity rather than just only human health. So that was kind of, for me, the interesting part of it, hygiene in its broadest sense, and the role of leadership in delivering hygiene. How research fits into that, it's quite clear that that developmental leadership was keen on understanding what's working, what's not working, constant adaptation of policies to try and get the right policy mix going. So, research in that context was very much part of a feedback loop, ground truthing policy, seeing if it was working, feeding it back to decision makers who would again try something new if it wasn't working. So that was my key takeaway, breaking orthodoxies.
Excellent. Okay, let's see if Robert can do better than that.
Sure, do what I can. This is the first time I'm using notes on my phone. I feel like I'm kind of like a naughty school kid, like texting, but it's all relevant. Thanks. Just kind of building off on some of the things that Henry said. It was, kind of coming at it more from the researcher perspective. And I think one of the things we've heard a lot over the past, I'd say probably 2 or 3 years, is over and over, like hand hygiene or hygiene became really important to the COVID pandemic, and then it's not important anymore. I do want to push back on that narrative some. I'm talking more about hygiene now than I ever have before, other than immediately during the pandemic period. So I do think this is all kind of part of this global hygiene symposium, all part of kind of a growing, ongoing dialogue around hand hygiene, around hygiene writ large, and its critical link with public health. And I do feel like there is quite a bit of momentum, and I think a lot of that is a tribute to the researchers and policymakers who are continuing to engage in this subject. Henry mentioned kind of, embedding research within policy, how to get kind of policymakers kind of, as part of that process. I think another part that was kind of discussed quite a bit, and again, a continuation of a lot of the ongoing dialogues here on some of the key research priorities as it relates to hygiene in the coming years. We know there is a clear health link between hygiene and kind of health outcomes. It is protective, or it does work. But that link is becoming increasingly complex because we're living in an increasingly complex world. We have unprecedented climate change, which is changing kind of how hygiene-related diseases, transmission patterns, and people's ability to mitigate that disease. We have the growing burden of AMR, which is the other crisis. Pick your crisis, which one is going to change a lot of what we're doing. And we also have kind of a new appreciation, a point of almost kind of self-reflection within the sector about our own role in propagating gender inequities, about how we've kind of taken hygiene interventions and traditionally focused those on mothers, and kind of that burden of kind of disease management really becoming a kind of gendered aspect of how we implement our programs. So I do feel like there's this, this other aspect of how do we take these small programs and kind of implement them at scale. We've all done pilot studies, we've all done these kind of interesting little things, but how do we make that transition transition from something small and interesting to something that's actually having kind of impact at a broader level. So I do think kind of at this meeting, kind of two key areas that kind of there seemed to be also kind of consensus emerging around that. And I'm really grateful for this. Just kind of look back, I guess now I'm at the point where I've been doing this for a while. But remember kind of early in my career, a conversation with someone from an agency that will go unnamed, who said kind of flippantly, if there's enough water to live, there's enough water to wash your hands. And I think we have now gotten to the point where we know that's not true. And we can all recognize that hygiene in any form, no matter how we're defining it, whether these broad approach by Singapore, whether the very narrow focus of hand hygiene, does require a basic access to infrastructure. There's this core investment that's necessary before we can really make gains on hygiene as an intervention. And so that's challenging our thoughts on hygiene as a low-cost intervention. Like, yeah, it's low cost, provided all those other basics are already there. And really understanding where hygiene really fits in our public health arsenal and how we can kind of make progress on this. So I'll stop there.
Okay, great. So thanks to both of you. Before I call on the next two speakers, I was wondering if there's anybody in the room who has a question about the symposium or about any of the things that Robert and Henry have talked about. You're all desperately trying to remember what they said. So, can I also just get a feel for who's in the room? Can we do a show of hands? How many people are here who would consider themselves researchers, academia? Okay, quite a lot of you. How many NGOs, practitioners? Okay. Wow, you're really in the minority. And government people? Mary, you have to put your hand up because you're government. Okay, all right. So this is great because we are talking mostly to a research crowd, which is great. So what I'm going to do now is I'm going to excuse Henry and Robert. And I'm going to ask, we've got two speakers to talk a little bit about, both of whom were at the symposium, to talk a little bit about their thoughts about overcoming barriers. Janala, you're going first? Yes, so first I'm going to call on Janala Chipungu, who is the head of Social and Behavior Research Department at the Center for Infectious Disease Research in Zambia. So if you want to come up and just talk for a few minutes. So what I'm going to do is I'm going to ask Janala to speak. Then Mary Ashinyo is going to speak, and then I'll open it up for questions in general after that.
Thanks, Clarissa. So I'll be talking to you a bit about research into practice, research into policy and practice. And I've had a number of thoughts, not only for this conference, but also through my experience as a researcher and where it ends, where the research ends. And the first thing I wanted to ask the audience is what is practice? And how practice means different things for different people, and also depends on the type of research that you're doing. And so thinking really about, when we're talking about policy into practice, starting from research, what does that really mean for you and your research? I personally feel that all research is relevant and useful. We heard from Bruce today that it's a whole process from guidelines development to practice. It starts with planning, and before it goes into policy, there's a whole lot of other steps that need to be taken. And in most cases, most well-conducted research is relevant for that process. Whether that is the end game of the practice, then there's a win. However, there's also practice where you want to see these translate into high-impact programs in in-country settings. And I think that's where the major challenge lies. And so thinking through what barriers do we have to overcome, I think there are a lot of barriers as researchers that we need to overcome, and also to feel relevant as a researcher, and to what extent that's where we go. So as we start our research, again, research can be very narrow or it can be wide, right? And depending on what you want at the end of the day, that really determines what to look for. The more I do research, the more I want to engage with stakeholders now. The more I don't want to be boxed up looking at research questions alone and answering them and publishing them. I think more about the relevance of these questions. I think more about how they can be taken up into our settings. And so when we're looking at our research studies, how narrow is our research or how broad is it? And I strongly believe that research now should definitely have stakeholder engagement budgets. So for us to then understand exactly where we want our research to go at the end of the day, we want to see our evidence being taken up into practice. Another important question is who sets the research agenda? The actors within the research community are many, from the researchers themselves, the funders, the different government implementing organizations. What is the role of each actor in this research process? And how do we leverage off each other's skills? And I think it's really important to start with that as we start research. Thinking about that later on only makes others feel irrelevant. But when you understand your stakeholders and their relevance and their roles, leveraging off each other, I believe, gives you more success in terms of how much practice goes into place after your research. One thing that I think is also equally important is that as we're doing research in a particular context, do we know where the research is situated within the national context? I think one thing that we're really good at as countries is developing policy guidelines. We think through them and the documents are there. But where are we situating our research, and are we situating our research within those policy documents? Do we know what those policy documents say? Do we know why this policy document has not been implemented? So we tend to start from a place where we don't understand where our research is situated at the national level. And I think that's really important. So gathering information within a country and situating our research to what gap are we trying to meet, what evidence are we trying to create is an important step in realizing practice with our research. And another thing that's, I'm not sure how to sort out this problem, but misaligned timelines. Hygiene is something that we need to implement now, but there's so little evidence around what hygiene means at the point of implementation. But where is the research to inform this? So currently, people need to be running around, researchers need to be running around creating this evidence, but at the same time, governments and policymakers need to develop these documents. And so if you look at these timelines, everybody needs to start now. But research is a process and it takes a long time to create this evidence. And so in terms of misaligned timelines, how to fix that problem is a very difficult thing. But I think one way, which takes me to the next point that I wanted to drive, is collaboration and coordination, is creating these platforms where we are coordinating and collaborating with different stakeholders who have different skills. The document is going to go out. If the government says it goes out on 1st January, it will go out on 1st January. Regardless of whether it's evidence-based or not, right? And so what do we do in this process? And so the one way in what we can move together is really creating these platforms where we're collaborating with these different actors that we have identified. But as a researcher, on our budgets, we also need to start thinking of having deliberate funds for stakeholder engagement and creating these platforms. Because what do these meetings mean? It means to bring people together in a central place regularly, long-term, to form these relationships. I mean, the morning we talked about trust and cohesion. That won't happen through emails. That's going to happen spending time talking and trying to solve problems, and it takes time. And so as part of our research budgets, it's important to have these budget lines where you can bring people together and have these platforms where you can discuss issues like hygiene, and especially for hygiene now that we're in a phase where we need to get it off the ground. And we have to get off the ground together as a coordinated team. Lastly, I wanted to talk about really understanding the countries that we do our research in. LMICs are really constrained with budgets. And it only dawned on me in this 2024 budget that we recently announced in Zambia. And we have allocated, or rather the government allocated 2.3 billion kwacha, which is about $90 million to WASH. That was in 2023. This year, it's gone down to $72 million. And when you look at the breakdown of these budgets in WASH, water resource management and development gets 25%, water supply gets 41%, Sanitation gets 32%. Management and support services gets 2%. I didn't hear any hygiene in that budget, and it really breaks my heart. When hygiene was spoken about, it was spoken about as health promotion. So what do we need to do as researchers? There's so much work we need to do. One, to get that hygiene agenda on that budget, to get that hygiene agenda in national programming, because at the national level, it's not there. It comes on as coupled with sanitation, but not as a standalone. And maybe it shouldn't come as a standalone, but it should have some targets. But if you break down that WASH budget, again, it's boreholes, it's water supply systems, it's sewer connections, nothing on hygiene. So there's a lot of work that researchers need to do to create these evidence and these toolkits for governments to use when making these decisions. But again, as mentioned, these countries are resource constrained. And so I think that's an important thing to note as well when it comes to policy into practice. How far can they go? It makes sense that water resource management and development takes the large chunk because Zambia is going through a drought right now. And so investment in this sector is important for the country. And so when it looks at really negotiating where to put your money, it really does boil down to how much funds we have to really put this and take up these initiatives that we create evidence for. And really just to cement this point is a couple of years ago, we worked on the multi-sectoral cholera plan. It's a beautiful document. Our president is the cholera champion in the cholera elimination plan. But we don't have money to take that document off the ground. Right now, as a country, we're talking about resource mobilization, just to show how serious the problem is. And we came out of a cholera outbreak. So while we're doing research, I think it's really important to contextualize the research and really understand in terms of resources, what do we need for us to create or to translate our research into practice. Thank you.
Thanks very much. Yeah, thank you for questions. So Mary, I'm going to call next on Mary Ashinyo, who leads the WASH program in the Ministry of Health in Ghana. And please start thinking of questions to ask either of our speakers.
Okay, so good afternoon, colleagues. And thanks for the opportunity to be part of this panel. So I usually have two versions of myself, the caffeinated and the non-caffeinated. Yesterday I was non-caffeinated, so I was very sober. Today I'm on a lot of coffee today. So I think I'm going to draw on the remarks from Henry, Robert, and Janala. I want to say that for us as policymakers, we have moved from evidence-based policymaking to evidence-informed policymaking, because policymaking is not just evidence. In fact, if you just make your policy based on evidence, most importantly, it's not going to work. So it is not 100% evidence. It's a mixture of evidence plus political acceptability, cultural correctness, contextual appropriateness. So I feel sometimes we don't understand each other. That is why we are not making progress. So it's important that we let you know as policymakers how we make our policy. So caveat, I am not just a policymaker. I'm a policymaker, I'm a researcher, I'm also a WASH expert. So I understand the perspective of all the stakeholders in the room. So Clarissa has given me 3 questions, so I'm going to attempt to answer all of them. The first one is provide examples of how researchers can engage policymakers early in the research process to ensure that their findings are actionable and relevant to the policy needs. And I think really the solution is already in the question. So the way to engage policymakers is to engage policymakers very early enough. You, as a researcher, you can't really do research for a policymaker. You do research with a policymaker for the policymaking process. If you really want research to be taken up by policymakers, that is how it goes. So I give you a typical example. During the COVID response, the first paper that came from Ghana on COVID-19, I published it, I was the PI. That paper had 19 authors. There was someone from FDA, other regulators, almost all the agencies of the Ministry of Health. Why? Because I wanted the findings from my paper to be implemented in all their decision making. I didn't assume that I was already a staff of the Ministry of Health, but I needed, even as an insider, I needed to make people feel very important, relevant, and part of the process. It's a human thing. People don't change to be human because they now work in an office. We are humans, we relate. So I think that making people feel that they are part of the process is important. And one of the ways that we have done this in the Ghana Health Service, we usually have a research agenda. And this is driven by the research division of the Ghana Health Service. So we'd have a document that shows 5 years. What do we want to do on research as a service? And that got me thinking, as WASH experts, do we come together as DPs and say, let's call researchers, WASH experts, and policymakers, and have this 10-page document that is a consensus on what research we want to conduct in the next 5 years? That would be a very important document, because then everyone who wants to conduct research just has to Google that document or go to the relevant ministries, get that document, and make sure their research fits into that agenda. And that is a research question policymakers want to answer. So if your research is answering those questions, then yes, of course, it would be part of policy. So I remember one of the papers that we published on COVID-19, we were trying to see how long do patients stay on the ward. And then we realized that it was between 7 to 10 days. So coincidentally, this also coincided with WHO's guidance on how long we should keep patients on the ward. And I remember my boss saying, my division needs to get the credit for informing the Ghana Health Service of that policy. And the following week, our wards were decongested of COVID-19 patients. Again, I didn't assume that because I am an insider, it is automatic that my research findings will be adopted. So engaging people, having an explicit document that states what policy, what research questions do we want to answer in the next 5 years or 2 years will be relevant for all stakeholders. The second one is what are some of the challenges in bridging the research and policy gap? Really, I don't think we have a challenge, honestly. When I go to non-governmental organizations, and government is portrayed as this false government. We are very nice people. We really want to hear from you. Don't get scared when you hear government. Any of you could work in government, right? Some of you have worked in government before, moving to non-government organizations. So I think just come to us, knock on our doors, talk to us. We are very nice people. So there's nothing scary about government. So I think the challenge there is that we don't engage enough. Right from the beginning, let's co-create the research. Co-creation, we say it a lot in our meetings, but we don't implement it as much as we say it. Sitting with people and asking them, what are your research needs? Because I don't know how it feels if you always do research and it ends up on the shelves, or it just goes to add to the university's archives. Of course, there are research that are for that purpose. But if it's more operational, or if your intention is to make sure that it is taken up into policy, then the most important thing to do is to co-create with government. And that is something that we are always looking forward to as government. Then I'll now come to the final one, which is what are some of the solutions? I think I have jotted 5 solutions. I've talked already about co-creation. The second one is that policymakers need to see researchers as the scientific and technical arm of the work they do. So although we say we are not doing evidence-based policy. We are doing evidence-informed policy. It is not zero evidence. There's no policy that is zero evidence. There's certainly some evidence there. But then there are contextual factors that need to come, and some of them will change. Example, when WHO was talking about face masks at the beginning of the pandemic, we all knew that we needed to wear face masks, right? But why did WHO at the beginning say, oh, there's no need for face masks? It's not because of the evidence. It's because of the economic significance of how much face masks then countries need to invest in. So those are some of the, how we tweak the evidence. And then later they say, oh yes, we should wear face masks. And then there were innovations about cloth face masks and other innovations. So certainly we need the evidence, and it is good for us to see researchers as the scientific and technical arm of the policymaking process. I've also talked about the agenda on research, the research agenda on WASH specifically already. Now, one of the things we also need to be thinking about as policy makers is sustainability. So it is not just coming to do research with policy makers, but it is also thinking about when the findings of the policy is out, how do you now translate that into programs or projects and then into practice? So it's not enough to say X works for B, yeah, then it's on the shelves. Government doesn't have that money. And again, I think we overestimate the funding muscle of government. Most African countries are still struggling to meet the Abuja Declaration of 15% investment into health. So governments don't always have money to translate research into policy and practice. So when we are co-creating the research at the beginning, we need to have the entire continuum in mind. Then the final one is that we need to foster cross-understanding of how different systems work. So I have had the privilege of not just working in government, but also in water aid, supporting WHO and other non-government organizations. And I think that personally, my work improved when I got to understand how the other side works. So it is important to ask people, how does government work? How does your daily process look like? How is decision made in government? What are the processes of decision making? I think that usually people knock on our door and they say, this is the concept note, we want to do this. Do you think you'll be interested? And the policymaker will say, yes, I will be interested. But do you think it would be contextually relevant to the work that you do? And I can say, well, not so much, but we can keep it for future. Yes, very much. And this is something that is top on the agenda. So understanding how the research you are bringing fits into policy making is also important, and which I understand the challenges because sometimes actually it's the source of the funding, where you're getting the funding from and what the funding is for. And then you can't come to the policymaker and everything changes because you now have to go and give account for the funding that has been given. But if even you are identifying the source of the funding right from the beginning, and for example, Ghana Health Service has an ongoing collaboration with UNC. We try to co-create the research right from start, and even identifying the source of the funding right from start, right? So that makes it easy because you as UNC then get to account for the funding that you have gotten, and then we as Ghana Health Service also get to use the results of the research for our work. So that becomes a win-win situation. So I think these are some of the things that we can do from a policy perspective, although I don't subscribe as a fully everything. I'm a public health person, and policy making, research, and all these functions are all part of the functions of public health. And that also is one of my recommendations. I think the difficulty also is that we over-describe the boundaries of things. We are too territorial. Meanwhile, I always say all these programs have been here for years. We come and we go, but these projects will be here for life. What should be always with us? So there's no need to be territorial and protective. You just come and do what you have to do to contribute to humanity. And others also get to do what they have to do. So let's be more open. Let's collaborate more. Let's stop defining the boundaries of things. We are this, you are that, you are that. Then that creates tension in the collaboration. But if we place the emphasis on the function, so what is the function? The function is to improve WASH, and that is the interest of everybody, irrespective of which category you belong to. So these are my very candid and vivid experience to share with you from the government perspective, and I hope it really works. It's not always a sweet pill, but if you really want to be able to work with government very well, you need to understand how government thinks, and this is how government thinks. Thank you.
Okay, thanks to both of you for those very thought-provoking remarks. I'm going to throw it open to questions right now. Let me just explain how the rest of the session is going to work. We'll have a bit of a Q&A right now, and then we're proposing to do a sort of World Cafe type small discussion groups. I'm thinking we'll divide into sort of 4 groups, given the number of people who are in the room, and then we'll come back and sort of share what comes out of those discussion groups. And we have a thought-provoking question to put to you for the discussion groups. But before we do that, I wanted to open it up for questions. And I've got one question over here, and then I've got a question for all of you. So we get to turn the tables.
Thank you. Mine is going to be actually a comment. So sometimes you hear people talk, they share their experiences. Dr. Ashino was sharing experiences, and I want to provide a practical experience working with her. I'm from an academic background, and over the COVID period, there was interest in implementing wastewater surveillance in Ghana. And I was working for Emory University, and we were thinking this will really be, help, especially because it was being implemented in high-income countries. How can this be adapted to low-income countries? So I was working with her on washing healthcare facilities. But I approached her because of where she sits and said, is government interested in this? And she was like, oh yes, we think we'll be interested. But I'm not too sure. Let me walk you to the director of Ghana Health Service. So she walked me to the director of Ghana Health Service, and we said, this is an idea in terms of your response to the pandemic. Will this be something that you'd be interested in? And he said, yes, I've seen this done in France. It will really help us because we don't have the diagnostic capacity. This will really support us in terms of early warning systems. And he said, go ahead and do this and let's see how it works. Long story short, today, because of that engagement we had with them from the beginning, Dr. Ashino doesn't know this. She just walked me to the director, and subsequently, the division that's responsible for this work, Division of Public Health, they have now taken that information and they are using it actively to inform public health. For example, when we did this work, there were 2 districts that during the COVID period, they hadn't reported any case of COVID throughout the pandemic. So the director of Ghana Health Service said, if this tool is going to help us, we have an issue where we think in these 2 districts already we have more than 3,000 cases, suspected cases of COVID in these 2 districts. But every time the results turn out negative clinically, can you use wastewater surveillance to see what's going on there? We went up north in rural Ghana. Because of this, we were able to test, and we saw that there were actually we tested in the latrines. We were able to show that actually there was COVID transmission in schools. So they knew that there might be an issue. Now they have to solve, is it because our diagnostic system is not working? Or is it because our public health response outbreaks are not working on the ground effectively? Because we can see that. So this is just a practical example of what she's saying. If you want to work, if you want your research to be evidence informed, then you have to understand what the government wants, how it fits into their strategy, and how it supports their everyday work. Thank you.
Thanks very much for that example. Yeah, that's good. Any other questions or comments? We've got one over here. Yeah.
Yeah, this is to Mary. You can be in my government anytime. I think accessibility to the government or to those in power differs on where you are. Maybe in high-income countries, it's really, really difficult to get through to those in power, even by email. The email gets shafted to a lot of people, but in the end, you don't know who you're talking to and where to go. So I also feel that maybe matters like hygiene and sanitation are not taken seriously in high-income countries. Hence, the representation here. I don't see a leading wash in any high-income country because those matters are not taken seriously. So, and also I'm finding through my research that maybe policy in things like hygiene, public toilets, which is extremely important now in high-income countries because we are all going big on, we are pedestrianizing everything. We're green spaces in public spaces to become climate friendly, yet there is no infrastructure like public toilets to support all that. So yeah, on policy, again, there's no policy. So how do you build policy from nothing, especially in referring to high-income countries? It's okay in low to middle-income countries because they are already having the building blocks from regulation into policy and the governments are cooperative, but high-income countries is completely the opposite.
Thanks very much. Oh, we've got some more questions. Very good. So I'm going to run through all the questions and then I'm going to come back to you two to answer them if that's okay.
Hi everyone, I'm Sabita, I'm from University of Sydney, and thank you for the great session. My question, I don't think it's a question, just a reflection on bridging the gap. So I'm a researcher and I came into this sector from practitioner to researcher thinking that I was working as a practitioner, and then I had to pause because I was implementing a lot of interventions without any evidence, and then I came back to the researcher and now I'm just like doing my research, and sometimes I get demotivated seeing a lot of paper being published and then not going into the practice. So I'm just thinking like, would the culture of like sharing failures in the WASH would help bridge this gap a bit more? It's not about like only publishing the positive impacts of the WASH. It's not only from the academic side, but also from the government or also from the practitioners, like being more transparent and sharing our vulnerability would help to bridge this gap a bit more than this is exactly in the system right now. So I'm just like, I just wanted like any of you to answer, like, would it like facilitate more if we have this culture of sharing what didn't work as well? Because we see a lot of intervention being repeated in a lot of organizations and also in the research, but not having, and we know how the publication works, like we do always publish like the positive impacts, but just not having those sharing of what didn't work, would that add value in bridging this gap as well? Thank you.
Thanks, and I think there's another question here. Back there.
Thank you for giving me the opportunity. I just wanted to support what my colleague there said, that I'm also a researcher, but before you get to these policymakers, it takes time, and at the end of the day, even when you have a very good idea, it's stuck within you. You don't know where it should go to. So at that point, how are you going to go about it? Thank you.
Thanks. And one back here, and then Christine, and then I think we should give the, oh no, there's another one there. Then I'm going to give the panelists a chance to respond.
Thank you. I have a comment and probably a question on I think the catchphrase that it should be evidence-informed and not evidence-based. I think I'm a proponent for evidence-based, and I think why I say so is because research needs to be contextual, good research. So when I do research, I think about the contextual issues, I think about the cultural considerations, I think about the setting that I'm working in, I think about those considerations, and I produce research which informs practice given those considerations. I do my research in a low middle income country. So when I publish, I am publishing in consideration to the communities that I work with. And therefore, the reason I'm pushing that is because there's really a thin line between evidence informed, because informed just means you can throw away the evidence and go with the context or the culture. And I think as academics and researchers, that's not what we want. We really want governments to base their decisions on research, which is contextual. Now, I think the bigger problem with research and why there's a big gap between research linking to practice and policy is because researchers are not really good communicators. So where is the research located? I always ask myself in our country, so where is the research located? It's in, journals. It's in very high level, kind of publications. The best research goes into, the best journals, and who reads those journals? How many policymakers open those journals to read them? So for me, one of the things I think which we need to do is to narrow the gap on misinformation, bring all the research information out there through other platforms. Publications is one of them, but then we need to invest more in bringing out research information out there so that we don't have to worry about culture, because what is culture? Culture is based on the understanding of the context. So if you want to look at pop culture, for example, it's what people see and read in the media. So if research is in the media, then it becomes part of that culture. So for me, I'm a big proponent of evidence-based and not evidence-informed. Thank you.
Okay, gosh, we're getting riled up here. That's excellent. Christine, and then you, and then you, and then we really have to stop.
Thank you. I'm Christine Moe. I'm from Emory University and another researcher. And Dr. Eshinyo, I was really struck by your comment in the plenary about how WASH is cross-cutting across AMR and maternal and child health and other fields. And I feel that with hygiene, our definition, our understanding of hygiene has grown a lot, especially thanks to the Reckitt Global Hygiene Institute. Now, I think you could make the same comment about hygiene being cross-cutting. As WASH researchers, we have found that food hygiene is really linked to poor hand hygiene, poor sanitation, poor water quality. And I want to ask you, where do you think food hygiene fits in government? So that's my question.
Okay. I'm Rehnuma Sara, I'm from Bangladesh. So I have two examples. So like Habib said, for environmental surveillance, we engage government from the beginning, and we have over and over meetings with different government bodies, and there is not much government people, health and WASH and some engineering department. So we are quite familiar with those people, and we had good successful outcome of that environmental surveillance project. And based on that, my next project on food hygiene, I use that link, I use those connections. And recently we had revolution in our country 2 months back. And for 15 hours, government fall apart. So those people send nowhere in those positions. So I don't know what will happen for my current project. So there is two examples of positive and negative policy, or probably I will seek your advice on that, how to manage things, because I have to work from the scratch right now and need to build those link again and again. So these are the challenges I think we face as a researcher. Thank you.
We'll take one last question over here and then ask Mary and Janela to respond.
Thank you so much. I'm Innocent Mwewaze from the African Population and Health Research Center. Yeah, currently I think this is challenging ourselves when we talk about policy and practice. And I'm questioning, or I started questioning myself, at what point do we write policy documents from evidence? So when you bring in your perspective of informed, do we then first translate, do we first have engagements, stakeholder engagements with the relevant stakeholders to then develop our policy documents? And I think that is key, because often we always develop our own policy documents and then we take them over. And I think that is a process that should have stakeholder engagements, then to agree on your findings and to synthesize what they mean for you to develop those nice summarized policy documents. Yeah, thank you. I thought I'd bring that one out.
Thanks very much. So I'm now going to go for great questions, very challenging questions, especially how to manage research in the context of revolution. That's a PhD thesis. I'm going to turn it over to Mary and Janala, and then that'll set up nicely for the World Cafe groups. Who would like to go first? Okay.
Okay, thank you very much. I will start from the revolution question about evidence-based versus evidence-informed. So please rest assured, when we say evidence-informed, it doesn't mean it is not evidence-based. I think evidence-informed means that the decision is informed by evidence. So there's still evidence there. Let me give you an example. Recently, with the Ghana Standards Authority, we're trying to determine how much boron should be in drinking water. And WHO's recommendation is that you shouldn't exceed 2.4, right? Now, to agree on how much boron should be in drinking water, you need to also look at how much boron is coming from other food sources. So when we finished the calculation, we said that it would be safe to increase the acceptable level of boron in drinking water from the current 0.5 to 1.0. And then there was an argument in the room. And the final conclusion is that WHO says 2.4. So even if you move from 0.5 to 1.0, you are still within 2.4 when you add the sources from other food sources. Why we had to change from 0.5 to 1.0 is because our engineers were having difficulty with their technology to maintain 0.5. So that becomes an economic reason why we are changing the level from 0.5 to 1.0 in drinking water. But it doesn't mean it is not evidence-based. So it's not pure, it's not just about the evidence, but then also contextually what engineering capacity does the country have? So when we looked at other countries, some were doing lower levels and some were actually doing higher levels than what we had agreed on. But that was based on our engineering capacity and the economic cost of maintaining the level at 0.5. Please, do you understand it? But it is still within the acceptable limit of WHO. So please, do you understand it? It is still evidence-based. Please, do you understand it? If you nod, then I can't go on. It looks like you know.
I actually
agree. Okay.
Yeah, I did not want to provide further explanation to this, but I just think since COVID we get a lot of pushback from policy. When you get into a room and you start talking about research and evidence, then you get slapped on the face, because I think some countries had really bad experience during COVID, and they felt that research let people down. We recommended things which were too difficult to implement, which left a lot of bruises on people. So I'm still a proponent of it. I understand your context and the meaning of it. But what I think is that I think scientists, we need to push much more so that we are not relegated to just one of the options, but really science needs to inform policy. Thank you.
Okay, excellent. So rest assured that we take the evidence into consideration when we are making the policy. Okay. Now, your second submission now brings me to the second point. In water aid, where I did some brief work, we were doing an analysis called entry point analysis, and we had a very wonderful tool to determine what level we can bring wash, okay? And I think that Habib gave a good example. When you are also engaged in government, it is good to identify an entry point. The program that Habib was bringing was not going to be in my department, but he understood or identified me as somebody who understood WASH, because you are going to be talking to, medical doctors. Our training is very narrow. It's about giving injection and writing treatment. And if we don't get to study public health, it means that we don't understand systems thinking. So he identified me as somebody who works in WASH and can explain to my colleagues the importance of this project. So after I linked him up with the team that he needed to work, you see, he didn't even come back to me to say that it's going well. You know, I didn't hear from him. But I'm happy that he's giving me some credit here in the room that I was supportive. So if you identify colleagues in government who can actually find the right people to talk to, they can actually link you to the team that you have to work with, and then you don't always meet the backlash. So it's not because people don't think evidence or research is important. It's just the training, and I think that we need to be looking at the curriculum of healthcare workers and putting some of the health systems thinking concept into the curriculum, so that by the time people start working, their minds is not just how to write prescription or give an injection, but they are thinking system-wide. So that I agree, but if you find a good entry point, you should be okay. The other one was about, I personally think that we need to demystify research. Research is not always there are different types of research, right? And I think what policymakers find very useful is the operational research, but then it also depends on the research question that you want to answer. So let's demystify research. Let's build capacity of policymakers to also analyze the data of the services that they are providing. Most of the papers I've published on WASH, they are not grant-funded research. They are just, we did WASH Fit assessment funded by WHO, usual projects, and I'm like, okay, we won't leave this on the shelf just as a report. We just analyze it in a different way, and we write a paper on WASH Fit, and we publish it. So if we begin to build capacity of policymakers to analyze their own data, then when you come to them to talk about research, it's not sounding like something that is not related to their work, but they will see it as looking at the data, trying to understand the whats, the whys, and the hows, and they welcome you. You become more, they see you as, they need research every day of their work in decision making. So when we are also developing research as part of the grants, let's put in a capacity building component that demystifies research to policymakers so that they don't feel it's something too academic, but it relates to the work that they do. Then the final, there was a question on food hygiene. Somehow I don't have a definite answer today, but I'm going to take your email and send you some responses, because for Ministry of Health, we don't do food hygiene currently. So I would like to make some inquiries, and then I'll send you an email immediately I get back home. I hope this works. Okay, perfect. Then there's a question about elections and when things change. So this year, more than half of the world will be having elections. Ghana, ours is in December, and government will change. Our DG will change, a lot of minister, everything will change. One of the, what has been helpful in our case is that we don't place WASH at a political leadership level. So deputy director level is a technical role, it's not a political role. So when elections change, technical people don't change. So if you anchor your PhD, and I do that for the UNC students who come to do data, PhD students who come to do data collection in Ghana, we anchor the project at the technical level. For political willingness, we just go to get the Director General's approval, like we did for Habib, but otherwise the entire implementation is at the technical level. And in any program that they need to collect data, I link them up to technical level leadership, not the political level. So I think that has been good in our experience. Also for WASH, Ghana has 16 regions, and in each region, we try to establish a regional WASH manager. So this is a regular healthcare worker who does the work they do when they come to work, but is also assigned to look at the data, assess the facility, and suggest action plans for improvement. So that is also a technical level. And then at the hospital level, we have over 11,000 healthcare facilities. 60% of them have WASH managers. That is also at a very technical level. So don't peg your project too much. I know sometimes when you come in country, you want political leadership, but I think after you've gone to pay your homage to the political leadership, you should anchor your project at the technical level, and that is more sustainable, even when elections change.
Thanks very much for that. Janala, do you want to come in?
Yeah, just a few reflections. I think the question on WASH failures, I think that's an important one. And I think, again, what's the definition of a failure? To what extent have you failed? When you publish your paper, we don't really track how far our evidence has gone. And as researchers, I think we should give ourselves a pat on the back once we do publish the paper, because it's out there for the world to use. But we don't track, and we don't know exactly the impact of that paper, but it's out there, and I think that should be a win. I think for me, in terms of a WASH failure, is sitting in a room and seeing something being adopted when I know that the evidence is there, and the evidence has not translated into this policy. That for me is a failure, especially if it's within my country. So I think a challenge to us is how closely are we working with advocates, how closely are we working with governments, how close are we working with implementation partners, because there are forums within the country where they meet and speak about these issues. And so to what extent are we leaning in on the table and presenting the evidence that we know? For me, that's a win in terms of translating our research into policy. So I think as researchers, I think we should give ourselves a pat on the back once we publish that paper. But again, we also need to be realistic about what we can do in terms of taking it forward, and to what extent do we pass the baton on to the next person who can help in advocating and taking that research into policy. I wanted to comment on the food hygiene question. I think that's a really good question. Where is it situated in the government? Through desk research that I've done in Zambia, it's really in the infant and young child feeding manual, so it doesn't stand alone, but it's part of your nutrition, most of your nutrition policies under the Ministry of Health, and there is where it's emphasized as part of nutrition, but does not stand out. But definitely, though, the evidence in that sector is generally low, and I think there's a lot more work that's needed in order to produce evidence in that area. I also wanted to just comment on the government positions and, what you said. I think it's very true. And governments are different, as somebody mentioned, and function differently. It can be a big bomber because the way the system plays, even at the technical level, sometimes it's difficult when the director or the PS has changed, because you need to convince them of your agenda. So I do resonate with you when you say, the whole system changes. How do we then get back on track, get a focal point person? Yes, at the technical level, but it also really depends on the structure of the government.
Okay, thanks very much to both of you. What I'd like to do now is divide up into 4 small groups. This is going to be an opportunity not only for you to discuss the question, but also to interact with both with Mary and Janala and Robert and Henry, because they'll be joining the groups. So the question that we suggest that we discuss is, what do we, as the research, policy making, and programming practice communities, need to do differently to make the translation of hygiene research into policy making more effective? So it's a direct carryover from the conversation we've been having. So we'll split into groups. I suggest we have one group here, maybe another one sort of here, one here. Oh, my groups are going to be uneven, aren't they? Anyway, you'll be able to reorganize yourselves, I hope, into equal groups, and I'm relying on you to do some herding. And we'll just chat for maybe about 10-15 minutes, And then I'll do a quick round to find out what the most interesting things are that you come up with before we close. Okay? So off you go into your groups.
I'm not sure if I was in this or this. It's just the way you group them. So, in this group. Oh, good for you to see me.
I'm not sure if the group here.
Are you still with me?
Maybe I can use this one.
Last time I checked, anyway. So maybe he would tackle him.
This is a confession. Can I join you? Yes. Oh, you are, no, I want you to be here.
It's all good.
Yeah. Everyone's rotation, I don't know.
I'm supposed to be a guest, like an observer in the group, so you're going to select your own moderator.
She showed me on the program
I'll
where
just
she's
listen
got
and if I need to
your name associated with her presentation, and she was wondering.
Our question was more like how do you find the translation of research into policy?
I'll find it and show you. But it was interesting to see your name, and it had your affiliation with your talk.
So volunteer.
Going to have an unusual question.
The surprise.
Because everyone had mentioned there's there's a lot of research that happens probably need non-translate policy level. It's still incredibly important at the local level of the implementation. So there's different challenges in how you translate that kind of research into effective execution of practice versus broader research that is intended or perhaps ought to inform policy. So water standards and that sort of thing. Is that policy or standards level? I'll start with the first page that happens. So is that a household level?
My research is mostly
water
washing
device
as well as a high-income country in US and essential appliances, I think. So I think just to give you a context, I think when we think about
the challenges of translating
about what a proper city is, right? We think about like cities like New York and like Philadelphia or something, right?
Maybe we just bring that into.
I was like doing my PhD at Reckitt policy. My research was mostly focused on engineered system, like distribution system and water quality issues. I didn't know the issue that's been like faced by millions of people in America.
I have another question. I was like, grab that.
Any income for these households is less than $30,000. They're living paycheck to paycheck and mostly
You'll be here on Friday.
the issue is have access to utility. This people depends on spring water, and the issue is
funding in a certain direction.
microbial and chemical contamination. So over the last couple of years, we are working with some of these folks trying to assess the exposure to microbial and chemical contamination, and trying to see how utility water quality is different than spring water. So one of the things we notice is like most of the spring water is heavily contaminated with E. coli, which we guess, and the recent flooding happened in East Tennessee and some of these regions. Now we can guess like on sewage and everything is mixed up with surface water and so like flooded, right? So you would think that why don't then the utility water is like provide provided to all these households. It's like a concern of financial system that you use in these communities, because I think they don't have enough money to plan the service systems. So one of the things we found out that the self-reported health outcome, like diarrhea, is actually 15-16%. So you think about the number, it's very concerning. Like it's like 16% in the diarrhea. And we actually, when I'm saying the number, it's not so I think we like stick with like so far. We have the same number has worked as we analyze history samples from children. Also, we analyze saliva samples from adults. We're saying the same thing in a concerning thing. I noticed finding these changes, and also chemical contamination is an issue in this area. And the thing is, even though people sometimes have access to utility water,
So I think that comes to what you were talking about, research.
so when for our research, we define children as less than 18 years. Advantageous. So
Injecting the right
for research, that's how, as far as IAB is concerned, you're pushing it to. So there is, but I can tell you more details about the decision making, but that's how we're defined. And the issue is also the trust issue with utility water. When you think about the Michigan crisis, something like health, right? Most of these folks, it's a cultural issue also, right? Who are part of America is completely different than on the side of structure. Most of these folks will say, hey, I've been drinking this water. That's good. Utility water, the chlorine smell, it's not good. They don't like it. Even if they have exposure to it, right? Organizations that like really don't we're trying to do like trying to build a relationship with this community and trying to build a trust. I think these communities have been very much affected by the opioid crisis also. So it's a complex thing. It's another the different world out there. Having a trust with this community is also an issue. I don't like academia or research services that think we are just there and we're benefited and we're going to technical work there as soon as we have that funding. This is done right. Exactly. So the way we are trying to build the trust is to develop and especially collect the samples. I know, like I think you mentioned about that's like wastewater, right? So following up, they need to get the data. It takes some time to publish. So we do like some of the analysis you can do within public analyze the results. Like the same those we do like this year for 20 African cell challenge. So what we do as soon as we get the results back, if we see something concerning, if we see equally that one and even have children in the household because we know through service and everything, we actually give them a crisis agenda. So the same night we get the results, we send them a result sheet with all these things and how does that best not using technical jargons, but like in something give them the numbers and statistic is one department we can use where they can reach out for help. So we're trying to build a relationship. And the issue is the trust and the culture. We're trying to work with the champion of that. I don't know if that's helpful cases in this area. So also being more personal promotion and like just difficult in this area. Because and I don't like trust people and everything, but it just back a little bit I'm willing to talk about whether or not the picture I had in my mind about this has completely changed, and it's like an experience here, like when because I just love working with these folks and trying to understand, and it just amazed me. Like, and I really appreciate the Washington high income session this year at UNC. Documentation is very. I'm not saying this is not an issue in low income country. Obviously, you should also learn. Coming back to your point, for more research, you should also learn how to improve that in this country.
We got to put your hand said because I also worked on water in Appalachia long time ago. They told me this was in southern West Virginia in coal mining villages, and they said, "Where are you from?" And I said, "I'm from northern West Virginia." And they said, "We thought you had a Pennsylvania accent."
Exactly.
So it's the accent, not just the color of your skin. The
Accent also is an issue.
It's very distrustful. I can talk to you about that more later.
So just to add on that, so the way we try to do it, so my accent is not anywhere near Southern accent, right? So for recruitment purposes, I actually use a student or students who are from this area, so they can talk. And for surveys and everything, we use students who have access to this technology. So you see, like accent, as soon as they will hear you, it's like, plan. And the consent forms, you have like so many things, and they would say, I know my rights, but get me started on
When it aligns with ongoing challenges that have been a mainstay for a long time, for example.
So curious, use that person as an entry point, so that person can actually give you access to the system. And that was an example of what
There hasn't been any solution to that. So you want to do something that aligns with
the government, and they know it to the top, they will run to it.
is facing
Like a policy book. Is that how they call it?
I like this one, because once you are on the
So I become their policy broker. I go and talk
research aligns with
this was very helpful for them to see. And you mentioned
So that's really interesting, because I think when we started, and I was talking with one of my colleagues today, like the that the difference between academia and industry, or like NGOs. So NGOs see the cool part of the research, they get to implement it, shouldn't get to implement it, but here, so this is what we are doing. So we are working with local activities. Some of these activities, they are the violator of the EPS and Drinking Water Act. That's why when you see a utility going under boil water advisory,
you don't have to do any research.
The trust back is really difficult. Once you lose the trust, it's really hard to same as in relationship with the utility, right? So we are working with this utility, trying to understand the issues with them, and we are actually trying to work with the utility to lead to that utility water is actually much better. In some cases, better than bottled water. Most of these folks, even though they don't have enough money to buy groceries and everything, they do use bottled water.
just identify.
Some of my research.
To carry out the research on well water and IDs and I think we can confirm that aspect.
It's not like me, I can go anywhere and talk to anybody. I don't know, but I don't really fear. It's like I have to stop I just came and said, I want to see your minister. He said, do you have an appointment? I said, no. Then I sit there until you allow me to see the minister. And I tell him, feel free to knock on people's doors. Sometimes if the technical person is the one needs it, you see it, because when you go to the next one, they give you access. So feel free to
sometimes also gone ahead to hire
it's not that difficult the way we see it on the other side. It is very easy, flexible.
I think you make a good point about finding a champion, finding someone who will.
Oh, yeah, exactly. So we're trying to build a trust. So I think some of the work we saw like over the years, we actually helped some of the utility to justify the extension. Through our research, we kind of in this area we looked at like the well water and the spring water quality. Some of these folks also drink spring water. So we are kind of helping the utility to expand their services. That's what we did. So one of the research we did, like pre-expansion, post-expansion, just to see the water quality differences. And the other thing, we are actually doing an intervention trial. If households will not get utility access in the next couple of years or so. The reason the topography is also a huge thing here. Some of the folks live in like in a mountain, and it's going to be impossible to get utility there. For the cost of pumps and everything. So we are working with those communities for intervention trial. One of the filters we use has both the capacity of removing microbial contamination. So we have a randomized control trial going on now for about issues. So that finds to be, like if you find that to be effective, those communities can use things like those filters. So funding and everything. So that's the thing, and we're trying to find solutions how those households actually have security.
That's what I'm saying. There will be opportunities for that, but that will not be something that.
I'm actually a food spec person, but I'm here to help a friend who there earlier this year, so I'm going to watch that as well. So I'm actually not a step one. Deserving, yeah.
And they now trust you. Everything works. And anytime
in this session,
it's okay. So the trust is happening in the previous
similar or different through the whole hygiene. In your example, we're talking about we got engaged with the local community, not the local organized utility, but it's actually accountability. It's taking years to get I wonder whether there's any kind of accountability for in those communities. That's different so who's responsible.
How you keep engaging? That's a tricky question. So the hygiene part of it, we are actually not, we haven't done that much research on hygiene. I think it's also tricky because one of the things I talk with my, when I say my PI, because I was a postdoc like this couple of months ago, one of the things is tricky how you talk with these folks, how much information you get from them, and also how you interact with them, because they're inviting you to their house, right? So if you try to be nosy, and also if you try to ask so many personal questions, sometimes it's like, exactly. I haven't looked into that yet, so maybe I'm guessing the local department could be responsible for working on those. So I am not helpful.
It's because the question is there. I was interested in how, see if you had any
I think what research can do is exactly. So we are one of the things I would say, we collect water samples from collecting. So we call like exposure versus source sample. The exposure, what did the government have as your exposure? We flash it from amplification was not a problem. Just you can notice, like in some of the households, you see like the government care taking water from the same faucet. It's an hygiene issue. So that's why what we do, we actually resources the head with us from the emergency that was called, thinking there's no contamination and everything. It was informed. So directly you can connect that with some of the hygiene issues, right? And the households, when we visit, I'm not gonna say anything bad about the performance and everything, but you would see the picture of our houses.
Okay. I can see that you've really got into this, which is great. So I hate to break it up, but I also know that you're going to need coffee, and I've got to send you on your way. I think the coffee break is only 15 minutes long in the afternoon, right? Yeah. Okay. So here's what I'm going to do. I'm not going to ask somebody to get up and report back because we've all been through that. So I'm going to come around here. And I'm going to ask one question of each group, okay? So this group, I'm going to ask, what is, from your conversation, what is the best recommendation you have in order to respond to the question? What advice would you give to any of those communities about how they could make the translation of research on hygiene into policy better?
There were so many good ones.
Exactly. Okay. Go out on a limb. No, you don't hold the microphone. You never get to hold the microphone.
Okay, so there were so many good ones, and it's really
okay. You only get one. You only get
but
one.
I think some of the themes were about engagement, continuous engagement, and the one that really struck me was having regular dialogue with decision makers, officials, and sort of working or setting up technical working groups. Many other really good suggestions.
Okay, great. And you've written them all down, I hope.
I've written them all down.
Okay, very good, very good. Okay, now I'm going to come over here, and I'm going to ask you a slightly different question. I'm going to ask you what happened in this group that you didn't expect. What topic came up that you didn't expect to cover?
We're a very open-minded group here, so
yes, okay.
I think toward the end we were having this conversation about transparency and giving people ownership, and it came up that if you have policy, as a researcher, if you have policymakers that are part of your research group, giving them ownership, allowing them to go to the conferences and present the work, allowing them to be part of getting it out there, putting them on the publications, and expecting that they're maybe not going to contribute as much to it as the research team is, but that they are part of this and that they can be the representative, and then by giving them that ownership, they can then take it and see you as an asset to then continue that relationship because they're benefiting from it.
Okay.
So I thought that was really interesting.
Change the power dynamic. Okay, that's very good. That's very good. Okay, now I'm going over here. And I'm going to go back, for this group, I'm going to go back to the question I asked the first group.
You wanted the second question.
You want the second? All right. For you could have the second question. What came up that you didn't expect?
Thanks for that. I think so for us, it was the high-income countries, actually, that was a discussion on the table. We were all talking about low income and how to get the policy into practice, but the experiences that we spoke about were more high income. And how there is, I think, very little knowledge at that national level of where the research sits. But regardless, I think what came out was working with the local utilities to push change and to drive change within the communities, but also working very closely with the communities and providing feedback to communities for them to adopt useful behaviors around water utility.
Okay, great. Now I'm going to crawl along here to get to the last group. Okay, I don't know who's going to answer my question, but what came out of this group that astonished you? Surprised you? Was there anything that came out in your group that surprised you?
Not so much a surprise.
This is how I maintain control.
Not so much a surprise, but we did discuss about the high-income countries here as well, and in the shock of knowing that we have similar problems with global south countries. In the UK, for example, with the homeless folks and not having access to basic hygiene, things that is classed as a human right, but then even in a high-income country, there are no policies in place to properly look after those who are homeless when it comes to sanitation and hygiene. And we also talked about how there's always a separate conference for politicians, a separate
bring the politicians here.
Why don't we bring them to? Why don't
we talk to each other?
Right.
For example, this conference is going on now, and there's the African Water Week going on in Cairo at the same time, where all the ministers for water and everybody who is somebody in Africa in water is sat. So how do we get to talk and
we should restructure the way we do conferences? Because we're all talking here, but we all agree with each other. We should bring the politicians here.
We should bring the politicians here. I agree, and I think ideas on how we could get politicians to come to a conference like this are very welcome. We've tried in the past to get ministers to come, and it's very tough. Ministers are up.
They will send their staff.
Exactly. In the end, they send their staff.
Not important for them.
But still, I think it's a worthy thing to aspire to. So thanks very much. I'm really glad you had interesting conversations. That was really good. Just as we're closing, I'm going to hand over to Sarah Roberts, who is the Executive Director of RGHI, the Reckitt Global Hygiene Institute, just to say a few words about how RGHI is going to keep this conversation going.
Absolutely. So hello everybody. I appreciate it is lovely today.
Is mic working?
Can you hear me?
Yeah. Yes. Lean into it a bit.
And that's probably far more appealing than what I've got to say, but I just wanted to say a few words before we close and acknowledge that RGHI has undergone some quite significant change since the Global Hygiene Symposium. We're constantly striving to evolve our grant portfolio and convening activities, which allows us to respond to the areas of greatest need. And in response to that, this summer we were able to launch the Collaboration Accelerator Award, which directly addresses the need, much of what we've been talking about today, to bring research and policy together. We've heard a lot about collaboration today and the value of that, and I truly believe that by bringing together diverse sectors and experience, RGHI can really support a meaningful impact in hygiene outcomes. So that just leaves me to say thank you so much for your time and insights today. Your really valuable contributions are going to help realign our convening activities for 25 and beyond. So watch this space. And if you could use the microphone. If you could just join me in thanking our panel for all the time and effort they've put in as well, and enjoy the rest of your conference, everyone. So thank you.
Actually had everyone else today, and we all have been in the
Hello, nice to meet you.
That's a good one.
I saw you earlier.
That's what's it.
Her name is Gloria.
Thank you very well.
So I'm going to
I think she did.
Okay, all right.
Different space.
Nigeria, we are kind of
So we're supposed to,
emotion
And you didn't find the bag?
So there is that.
Yeah, the other thing. Okay, it's all right. Are you all right?
So you just need someone to say
At the same time, some such. Oh, we're different. What's one of them?
You have different because their expertise is slightly you don't. It's always that challenge.
What is the session?
I'm going to a session. What everybody else.